All right, let's go ahead and get started. We are expecting a lot more people. I had about 50 people register, but there's a lot to cover, and I want to make sure that we have plenty of time for questions. So just again, if you do want a copy of these slides, please fill out this form. I put the link in the chat, and there's the QR code here. It just asks for your email address, and then I will send these slides afterwards. There's a lot of information and it can be a lot to process. So I want you guys to leave with something tangible that you can really hold on to. So, hey everyone, my name is Dr. Dana Saifan. I am a professor here in the psychology department. I'm a clinical psychologist by training. I have my PhD in clinical psychology from UCLA. And I'm also a licensed psychologist, meaning that I can do therapy independently. So that's just a little bit of my background, and happy to answer questions about that later. I know I got some questions on the registration form. But essentially, what today is going to look like, I know a lot of you are very interested in clinical careers, but might not know what are all of your options and, where do you start and what's the difference between all of the programs. So I'm going to start by just giving information about different careers and mental health services. So we'll talk about social work, marriage and family therapy, different disciplines of psychology, as well as psychiatry. Then I'll also kind of talk about grad school application tips. And then we will save the rest of the time for just open Q&A. So with mental health services, there are so many different careers that you can do. So again, these are the ones that we are going to focus on today, but there's other options like public health, psychiatric nursing, becoming an occupational therapist, an art therapist, a certified mental health professional, and so on. So there are other things that are related, but the most popular ones are these on the left that we're going to talk about. So for each one of these, I'll kind of go through, what does someone do in this job? I'll also talk a little bit about what education is necessary. And then we'll just kind of skip on to the next one. So I'm not going to read through all of the information on the slides. I'm just going to kind of give a summary because again, I want to make sure that we have enough time for you guys to ask questions that you specifically are interested in. So social work. When we talk about social work, there's really kind of two main types. There's what's called direct service social work and then what's called clinical social work. So direct service social work is a lot of times when we think about like case management, that's what that is referring to. It helps people to solve and cope with everyday problems, helping people figure out like what needs they have, what goals they have, and how to achieve those things. And that helps link people to different resources in their community, and to help people access supports from government agencies. So that is when we kind of typically think of a social worker, it is a direct service social worker. Another kind of social worker is clinical social work, and these are people that actually are doing therapy. So they provide individual therapy primarily, but also can do group, couples, or family therapy. They usually work within a treatment team, and they monitor progress throughout therapy and will adjust as needed. So I will talk a little bit about the main difference between becoming like a clinical social worker versus like a marriage and family therapist. In a lot of states, clinical social workers are the main frontline therapists. California is a bit unique because marriage and family therapy is very popular here, but it's not as like widespread in other places. So in the day-to-day, both a clinical social worker and a marriage and family therapist are going to be playing very similar roles. The main difference is that if you know that you want to do like couples work, or if you really want to emphasize working with families to like deal with family problems, then a marriage and family therapy degree is going to be a better fit for you. If you want to work kind of more generally, a clinical social work degree is just fine. And the main difference is going to be in like the kind of training that you get. So social work tends to have training that is more focused on kind of like bigger systems and how that might impact people. Marriage and family therapy is very relational. And so you're going to get a lot of training on different like family dynamics or couples dynamics, things like that, that you're not going to get necessarily within clinical social work. So if you want to go into social work, in terms of education that's needed, you could get a bachelor's and do kind of entry level stuff like being a caseworker. But most places you do need a master's in social work. And especially if you want to do like clinical work, you need a master's. Most of those programs are 2 years. Some can be shorter if you do have a bachelor's in social work. And if you want to do more of like the higher level, like research or program development or training other people, then you could get a PhD in social work. After you finish your education, you do get licensed. So those license requirements are going to vary by state. And part of that is that you need to have a certain number of years or hours of supervised experience, and then you have to take an exam for that state. So that is going to be pretty much the same for any sort of clinical position, whether it's an MFT, becoming a psychologist. It requires you to have the degree, have a certain number of clinical hours where you're being supervised, and having to take at least one exam. Social workers can work in a lot of settings. You can work in a clinic, a hospital, you can have your own private practice, work in a school. And then I do provide, a lot of us, we want to make sure we're making some money in our job, and LA is very expensive. So I provide here just kind of what the median salary was. It's a couple years old, as well as the job outlook. So that basically means like how many new jobs are being added to the workforce within this field. So the median salary was around 58,000, but there is a lot of variance, and obviously like the more advanced degree that you have, the higher your pay can be. And job outlook is 7%, meaning that it is growing 7% in this time frame that it's expected to grow, and that's faster than average, so that's good. And then I provide some information here. So marriage and family therapy. So again, these are people that are doing therapy, but really being trained in family systems, and really specializing within the context of like marriage, couple, and family systems. Though you could, get an MFT and choose to not work with couples or families, that's also totally fine. You could just work with individuals. But it does make sure that you have enough training in case you do want to work in these contexts. And again, the perspective there, rather than like a larger system, you can, it really is focused more on like the relational dynamics. I see a question in the chat. Yes, Patricia. If you have a BA in psych and you want to apply for MSW, it is going to be the 2 years. So it can be shortened only if you have a bachelor's in social work specifically. And feel free, all of you, like if you have questions come up throughout this, feel free to put it in the chat. If it makes sense for me to address it right then, I will. Otherwise, I'll go back to these at the end when we get to the Ask Me Anything portion, but I don't want you to lose your questions. So for MFTs, you have three options. So the most common is getting a master's, and that is usually 2 to 3 years. So just kind of depending on like how intense you want the program to be. A lot of programs will kind of give you an option, like you could do a really intensive 2 year track or like a more laid back 3 year track. So just up to you. You could also get a PhD. So that's going to be closer to 5 years unless you have like a master's beforehand. Or you could do a postgraduate clinical training program, meaning that you don't have a master's in marriage and family therapy, but then do some other program afterwards. But that one I don't recommend. It doesn't make much sense. You see, it takes 3 to 4 years. So you might as well just go and get the master's degree specifically in marriage and family therapy. Similarly to social work, you do need to get licensed eventually if you want to be able to practice on your own. So when I say that you're licensed, that means that you don't have to be supervised anymore. You kind of have independence. You can have your own private practice if you want. You also have the ability to supervise other people that are currently being trained. So to do that, you do have to take a national licensing exam and have 2 years of experience. And then depending on the state, you might have to take a state exam as well. So in California, you would have to take like a California exam for this. Most work in private practice or in mental health settings. The median salary is listed here, and the projected growth is 16%, which is much faster than average, which is great. So those are our two main like master's level clinical degrees. So let's talk a little bit about psychology. So when we talk about psychology, we are talking about a doctoral degree, and that can be either a PhD or a PsyD. And then there's different subdisciplines within psychology that you can choose to pursue. So clinical psychology has a lot of kind of different options of what you could do. Research is a big part of it, being able to do assessments of people to like diagnose people, but also kind of more complex assessments. For example, for like ADHD or learning disabilities, you can't do those things as like an MFT or an MSW. You have to have a psychology doctoral degree for that. You could also do teaching, consultation, you can work in forensics, and also do program development and administration. So like being a clinic director. Um, and one thing to note here, because a lot of people don't know the difference between like a psychologist and a psychiatrist. In most states, I think like all but one maybe, you don't prescribe medication. That is what psychiatrists do. They are medical doctors. But as a clinical psychologist, you might work closely with a psychiatrist to support your client. In terms of clinical psych, there are some master's programs in clinical psychology, but really important to know you can't really do much with that. You can't practice like as a psychologist with that, and you're usually not getting clinical training in that. So most either you do a PhD or a PsyD. So the main difference here is PhDs are usually in universities, whereas PsyDs are usually in like for-profit institutions, meaning that PsyDs are very expensive and PhDs are often free. Your tuition often gets covered by you working for the university in some way, like being a TA. Both programs are usually 5 to 6 years. It's usually 5 years at the actual university, and then the sixth year is a clinical internship where you're doing like full-time clinical work in some sort of clinic that you get matched to, similar to like a medical residency. Um, and the other really big difference is in like what your focus is. So PhDs are very research focused. So it balances both research and clinical work, whereas a PsyD is very clinically focused. So if you know you do not like research, but you want to be able to do clinical work, you want to be able to do assessments, you want to be a clinical director, then a PsyD might be the way to go. If you really like research, if you think you want to be a professor, or you want research to be a big part of your career, then the PhD would be a way to go. You also need to get licensed here. So I'm going to kind of skip the master's degree part because, again, it's like not a traditional route that I would recommend because you basically would get the master's in clinical psych and then have to do another like 3 to 4 year program afterwards. Doesn't make that much sense. The doctoral degree, after you finish your program, you have to get 2 years of additional experience, and you take a national licensing exam called the EPPP. And then you usually will have to take a state exam. So like in California, you have to take like a state law and ethics exam, and then you can be licensed. You can work in so many different settings as a clinical psychologist. A lot go into academia or clinical practice. So, having their own private practice or running a clinic. There are also more like non-traditional routes, like going into like policy and advocacy, for example. So the median salary here is higher, as you can see, and the projected growth is 7%, which is faster than average. Question about if you could do a PsyD after undergraduate, or if you need to complete a master's first. For a PsyD or a PhD, you don't need a master's beforehand. In fact, while you're in the program, you get your master's along the way. And so even if you have a master's before, it does not make it shorter for you. You still have to go through their coursework, their curriculum. So you might end up with like two masters, but you definitely don't need a master's first, but in some situations it could make you a stronger practice. And if you have a PhD in clinical psych, you don't need to do clinical work. I mean, during the program, you do have to do clinical work, but your end goal after you graduate, you can go into academia where you're just doing research and teaching, and don't do any clinical work aside from that. So that's kind of what's nice about a clinical psych degree is that you have a lot of flexibility. The job can look so many different ways, really based on what your interests are and what you care about. Correct, Whitney. So you apply directly to the PhD and then you get your master's along the way. It's not like a separate application, it's built into the program. And then here are some resources for you all. So that's clinical psychology. Counseling psychology, a lot of people don't know the difference between this. So this is also a doctorate program. And it's similar to clinical psychology, but where clinical psychology really focuses a lot on like mental health, mental illness, um, counseling is focused on more like normative, less severe problems. So things like, having family conflict or adjusting to a new job or adjusting to college, things that are not very severe, right? Whereas if someone is experiencing like a lot of mental health symptoms, a lot of distress, that would be more in the clinical psych route. Counseling psychologists can also be trained in like helping people figure out their careers in group therapy, and they might also get they get training in relational counseling as well. So for this, most pursue doctoral degrees. There are fewer counseling than clinical programs, so there's not as many options. And a big difference too is whereas like a clinical psych PhD program is going to be housed within a psychology department, counseling is usually housed within like a college of education. And then we have school psych, which is also similar to clinical psychology, but has a lot of like specialized training in education, child development and behavior, and the psychology of learning. And school psychologists usually work within school settings. So these are people that are going to like do assessments of students for like special education services like IEPs, might collaborate with teachers or school administrators to try to kind of create interventions within the school setting to help students. They might see students and their families for individual and group therapy, and they might design like prevention programs for the school to like reduce dropout. They might evaluate existing programs and help teachers kind of maximize their teaching efficacy. So like maybe training teachers on like behavior management things. So pretty different in that realm where again, if you know that you want to work in a school, like school psych could be the way to go. You could get a master's in school psychology, but you are going to be more limited in terms of what you can do there. So, like, you might be able to do some of the counseling, but not necessarily all of the assessments. You also can go the route of becoming like an education specialist, or you can get a doctorate, which would be a PsyD, a PhD, or a doctor of education. So, all of these are kind of different routes for school psychology that are pretty similar, but the focus of the work and like exactly what you're able to do might differ a little bit across degrees. School psychology programs are often within colleges of education, but might also be within like a department of psychology. In terms of what training you need, it's usually 3 to 4 years with like in grad school and then doing a 9-month internship in a school setting. That's to become a specialist. To get a doctorate, it's 5 to 7 years of graduate training and then a full 1 year internship in a school setting. So the doctoral training between like school psych, counseling, and clinical are all going to be pretty similar in terms of length and setup. And then in terms of the salary and career growth, that is similar to clinical psychology. So the last part of psych that I'll talk about is forensic psychology, because a lot of you were interested in this based on the registration forms. And let me just put, again, before I forget, for people who are new here in the chat, I put a link. If you want a copy of these slides, please provide your email address in the link that I just dropped, and I will email them afterwards. So for forensic psychologists, these are people that work within the legal system. So they are usually like expert witnesses that are hired by the courts, and they provide psychological evaluations for people for the court. Um, so please put the link, sorry, please put your email address in the link rather than messaging me on Zoom because I will not keep track of it on Zoom. So please fill out that link that I dropped if you want it. Thanks. I got a couple of messages from people, so make sure you guys put it in the link. So they will provide a psychological evaluation. They'll write reports for the court. They'll review documents. They might also testify in court and also kind of determine if a defendant is what we call competent to stand trial. Um, they might also like analyze behavior among defendants and help with like individual behavior plans and like work with people that are incarcerated. They might work in prisons, rehabilitation centers, police departments, courthouses, law firms, school, government agencies, or private practice. So to become a forensic psychologist, you could either get a PhD in forensic psychology, but there's not that many programs for that, or you can get a PhD in clinical psych or a PsyD, which is more common. You do usually need a doctorate degree because one of the main parts of the job is doing assessments. And so again, to do assessment, you need a doctoral degree rather than a master's degree. If you do get like the clinical psych PhD or the PsyD, then you should complete a postdoctoral training in forensic psychology afterwards, so you can really get that specialized forensic training. So that is forensic psych in terms of, again, like the education, the clinical psych part for the education and licensing requirements, because that's going to be similar. All right, so I'm not going to go through this as in depth because I'm just mindful of time. But it's a little bit outdated, but it just kind of shows a general um, kind of breakdown of different types of programs and kind of how competitive they are and how expensive they are. But in a nutshell, clinical psych PhD is going to be like the most competitive. PhD programs in general are more competitive. And again, they are cheaper. You're usually not paying out of pocket. Some programs you do, so don't assume. But most they will kind of give you opportunities to work while you're at the university, and that covers your tuition and also gives you a very modest stipend for living. A PsyD program is going to be less competitive, more expensive. There are some PsyD programs that are based in universities, which are going to be cheaper, but I don't believe there are any in California. There's very few of them, though the Cal States are starting to talk about maybe trying to offer PsyD programs, but that's still a far ways out. And this is just kind of a fun slide for you guys to check out later, looking at the amount of debt that gets accrued from a PhD in PsyD. So I don't want to share this just to discourage you, right? Like I don't want people applying to PhD programs just because the PsyD is expensive. But to just really think about, is this what you want to do? And to be really sure about your decision, right? So really think through, and we'll talk about this when I get to like applying, like what do you want to be able to do on your day to day? Right? Like some people feel like, oh, I need to get a doctorate because that's like the highest degree and that's what my family would want. And I want to like make my family proud. When really what they want to do on a day to day can absolutely just be done with a master's. And that's going to be what makes the most sense. Right? If you want a doctorate because you want to be able to do assessments and you want to be a program director, and you do not really want to do research, like don't do a PhD because you're going to be miserable. Like research is such a huge part of the PhD, right? And it's a 6 years. So you don't want to be miserable for 6 years. The PsyD is really for some people, it's not for everyone. There is a cost with it for the most part. But really just take the time to figure out what you really think that you want to do. And figure out what's feasible for you. So a lot of the PsyD programs too are set up in a way that will allow you to like work while you're in school, Some programs might, they might have scholarships, financial aid, things like that. But you just have to figure out what makes the most sense for your life. All right, the last career we're going to talk about is psychiatry, which is very different from all of the other ones. So psychiatry these are medical doctors. So they go to med school and then they specialize in diagnosing, treating, and preventing mental illness, including substance use disorders. But their method of treatment is not through therapy, it is through medication, right? So they might get like some training and like basic therapy, but they should not be the ones doing therapy. They should be referring people to a therapist, and then they are doing the medication management. Um, so here again, you have to go to med school and then you do 4 years of residency in psychiatry specifically. And depending on like if you want to subspecialize or work with certain populations like children, then you might need additional training after that as well. You have to do exams to get licensed by the state, and then you can also do like a voluntary exam to become board certified. Psychiatrists usually can work in a lot of settings, hospitals, within the industry. They might work at like a university medical center, just at like a regular community clinic, a rehab program, private practice, pretty much like any place that mental health treatment might be happening. They might have psychiatrists there. The median salary you see here is much, much higher, but the debt is also very, very high. The job outlook is 4%, which is as fast as average. So not the best, but not bad. It's not declining. All right, I got a question. Could you be a psychiatrist and a psychologist at the same time? I mean, if you want to spend a lot of time in school, sure, you can get an MD and go through all of that and get a PhD or a PsyD. But usually people are going to pick one or the other because that's like minimum, probably 20 years of schooling between all of that. So it's a lot. Um, okay, I got another question. If there are certifications or post-bac programs that you recommend to work in hospitals or clinics or anything, want to find out what I can do for now just with a bachelor's degree. All right, so there's questions, and I got this too from in the registrations of like, what can you do clinically just with the master's, or sorry, just with the bachelor's if you don't want to go on to grad school? Um, Unfortunately, the answer is that it's very limited, right? If you want to do clinical work, it requires a lot of training that you're not going to get in a bachelor's program, right? Really, the main thing that you could do with a bachelor's degree is go into like applied behavior analysis. So that is often working with youth with like autism. That is going to be like the most kind of straightforward. There might be other roles within like a hospital or clinic, like helping again with like case management or things like that, but you will be kind of stuck at more of like those entry positions. And you definitely can't do something like provide therapy to someone with a bachelor's. All right, so that's what I have in terms of content for career options. So let's talk a little bit about like how you figure out what you want to do and what grad school looks like, and then we will open it up to more questions. So often when you are in college, you feel a lot of pressure to like have to go to grad school right away, to have to even pursue a grad program in the first place. And I always really emphasize to students like, slow down, give yourself time, and really take the time to figure out what you want to do, right? Because as we've seen, all of these programs are very time intensive, they are expensive, they're a commitment, and it doesn't make sense to pursue it if you aren't 100% sure it is what you want to do. So that's the number one thing that I will say. Also, again, having a clinical career is one of those things that's a little bit hard to know 100% if you want to do because you can't really get a lot of experience beforehand to like try it out and figure out if it's what you want to do, right? Obviously, it's like very sensitive stuff to be doing therapy. And so not anyone can go and do it. There's a lot of gatekeeping. But put yourself in positions where you can kind of get tastes of it, to get a sense of if it's what you want to do. So for example, you might like volunteer at like a crisis line, right? Maybe you volunteer at a school working with kids if you're thinking about becoming like a child therapist. Just kind of getting like little hints of like what is it like to work with people in a setting where you're helping them, where you're kind of dealing maybe with different aspects of mental health, to try to inform it as much as possible. You know, if you're considering a PhD, like definitely get research experience, figure out if you really want to do that. Find people that are actually doing the job that you think you want to be doing and reach out to them. Ask them to meet up for coffee, ask them for a Zoom meeting, and just talk to them and get a sense of like what is their day-to-day like. And all of that can really kind of help you narrow it down. So if you do choose to go to grad school, first you have to figure out what career you want. So I always say, ask these three questions. What population do you feel like you want to work with? Do you feel like you really want to work with kids? Do you want to work with elderly people? Is there a certain like clinical disorder, like I want to work with PTSD or depression? What kind of setting do you kind of see yourself working in? Do you want to work in a hospital, a school, a university, a community clinic? And what kind of work do you feel like you want to do on the day to day? Do you want to be doing therapy? Do you want to be doing assessment, research, teaching, more administrative work? And your answers to those things are going to kind of help you figure out what type of program you want to apply to. So I'm going to go through kind of the general components of grad school applications. Um, I will kind of some things are going to be similar across all types of programs. There are going to be distinctions between like a master's level program and a doctoral program. So I'll try to like distinguish that along the way. So for psychology programs, meaning doctoral programs, usually it's recommended you apply to like 12 to 15 schools, given that it is competitive. And so you want to kind of think about like, do you have geographic restrictions? What kind of balance do you want between like research and clinical work? And what is the funding that that university provides? There is a book that is updated pretty much every year, maybe every other year, called Insider's Guide to Graduate Programs in Clinical and Counseling Psychology. I highly recommend this. I used this when I was applying. It basically lists every single university in the country that has a clinical program or a counseling program, as well as some like just brief information about it that can be really helpful in figuring out like what's like the research to clinical balance. Like there are some PhD programs that are more equally balanced between research and clinical work. Some programs are very, very research focused with little balance, little emphasis on clinical work. So you can kind of see that. It also provide information around like funding, what kind of topics people there are doing work in, and so on. When you're applying to a doctoral program, here's a key difference between doctoral programs and master's programs. When you apply to a master's program, you apply to the general program and you're accepted by the general program. For a doctoral program, you usually are applying to work with a particular mentor, and you get accepted by the program, but you're accepted to work with a specific person for the most part. So in PhD programs, it's like, who would you want to be doing research with? In a PsyD program, you do still have to do a dissertation, but what kind of counts as a dissertation and the intensity of it is very, very different from a PhD program. So you do still apply to like work with a mentor. So you want to figure out like who are people that are good fits for you. And the fit is like a very, very, very important part of that application. You can have the strongest application, but if you're not a good fit with a potential mentor, like your interests do not align, they will not be able to support you in what you want to do, then you're not going to get accepted, right? So that is really, really important. In terms of the application timeline, I want to say like maybe in March through May, you want to kind of start thinking about the programs that you want to apply to, and just get a sense of what their requirements might be. So I put in here, anytime there's an asterisk related to the GRE, there's an asterisk there because over the last 5 years, this has shifted a lot, where a lot of programs are no longer requiring the GRE. So this really started shifting. I mean, the conversation started before COVID, but obviously during COVID, when people could not take the GRE, those were no longer being required. But there's a lot of recognition that standardized tests are inherently biased. and work against marginalized communities. And so for equity purposes, a lot of programs do not require the GRE anymore. So you want to just kind of start looking early on though, because if programs that you're really interested in do require the GRE, then you want to know that ahead of time. Sorry, the GRE is like basically like a grad school version of the SAT. So it's a huge standardized test. There's like a reading section, there's a math section, a writing section. So it's like grad school SAT essentially. So there's a general GRE and then there's GRE subject tests. So for example, there's like a GRE psychology test, which is a standardized test to assess your psychology knowledge. So some programs do require the GRE, some might require a subject test, and some will say you need a subject test if you weren't a psychology major. But again, most programs have phased these out. So you want to kind of think ahead of on that. The subject test also is only offered like I believe 3 times a year. Someone dropped a link in the chat. This is an excellent resource, the Mitch's grad school, uncensored grad school advice. Really, really good resource. Highly recommend downloading that. Thank you for dropping that in, Rosemary. Around September is when things are really going to ramp up. Sorry, I think there might have just been an earthquake on campus. Okay. So you want to finalize your CV. You want to request letters of recommendation ahead of time. Okay, give people a couple of months. And I'll talk about letters of rec a little bit more in a bit. You want to start emailing potential mentors if you're applying to a doctoral program. You want to start drafting your personal statement. Okay, accept that the different parts of your application are not going to be like first draft is what you submit. Okay, you want to give yourself plenty of time to go through a bunch of drafts to get feedback from different people so that you can really have the strongest application because applications are time intensive and expensive. So you really want to try to have your application be as strong as possible when you apply. October, you want to finalize your materials, order transcripts. Applications get earlier and earlier every year. So now they start like November 1st. And they might go all the way to like mid-January. And then a lot of clinical programs do have interviews as part of the process, and that usually will happen between like January, February. So you want to budget for the application. They can range from like $50 to $100 each. A lot of times universities might have a fee waiver based on need. The GRE is expensive, so I put the costs there, both to take it and to send it. If a university does not need the GRE, if none of the schools you're applying to need the GRE, don't take it. I come across students all the time that are like, I'm going to take it so it can make my application stronger. If it's not required, it's not going to make your application stronger. Save your time and energy for what they're actually asking for. Okay. Transcripts, sometimes, places will require a fee for that. Other times it'll be free. You need your college your college transcripts. You also need your community college transcripts if you went to community college. Also budgeting and funds for interviews. So this also has kind of shifted where due to equity, there has been like a push to kind of do more, to either do like online interviews, even though a lot of schools don't want to do that, or to try to pay to cover students' costs. So usually there'll at least be an option for housing, like not the most comfortable thing, but like you might stay on the couch of a current grad student. But usually you do have to pay for the travel if it's like an in-person interview. So there's 4 main things that grad programs prioritize. So good GPA and test scores, independent research or clinical experience. I put or here because it really depends on the program. So if you're applying to a research-focused program like a PhD, the research experience is what matters. If you're applying to a clinically oriented program like a clinical master's program or a PsyD, the clinical experience matters more. Then you need clear interests that fit, especially for a doctoral program, and strong letters of recommendation are incredibly important. So let's go through each of these real quick. Again, I'm not going to read through all of this because I want you guys to have time for questions. So there isn't like a set GPA. Each program will kind of mention, um, maybe if they have a minimum GPA, they also should publish on there like what the average GPA is for like the incoming classes. So you can kind of get a sense of if you're familiar, if you're strong or not. Um, if you have a lower GPA, don't let that keep you from applying, especially if you feel like there were certain circumstances that impacted your academics. And usually there's going to be some either section of the application specifically where you could address like, maybe a weak part of your application, like, why these 2 semesters, if you're, dealing with housing and food insecurity, is your GPA a little bit lower. So either there's going to be a section for that, or if not, then you can incorporate that into like your personal statement to kind of explain it, right? Obviously you don't want to be explaining every single semester, but a lot of times like there might be a story for one part of your college experience that was not as strong, and you definitely like want to advocate for yourself there. They often will look at your overall GPA as well as maybe your major GPA. Some will look at just like your GPA over the last 2 years. Um, there's tips here for how to ace the GRE. I'm not going to go over this, but you have it in the slides just because most programs don't require the GRE anymore. In terms of experience that you need, for research experience for PhD programs, you really do need a good amount of experience. These programs are very competitive. And so having like 2 years of experience in undergrad, often the norm now for like a clinical psych PhD is to get like 2 years of experience post-bac. So that might be being like a full-time research coordinator for someone. That might be getting like a research-oriented master's degree, like our master's in psych program here. So you do need to have like a good amount of research skill. Doing like an honors thesis or a master's thesis is really helpful, and then getting like experiences presenting at conferences. And then I will say, like, you don't want to jump between labs. Some people feel like I need to be part of like 5 different labs to show I have a bunch of different experience, but that's not going to look as good as like staying in like 1 or 2 labs where you get really involved, right? So you want to kind of talk about like, you want to think about what is going to give you the richest, most in-depth experience. There are also like summer research programs, so like have productive summers, volunteer with faculty, try to get some clinical experience in the summers, like really take advantage of your summers. So for clinical programs, again, research-focused programs don't really prioritize clinical experience, but clinical experience will still help you to figure out like if this is really what you want to do, what populations do you want to work with, and it can also inform your research interests. For a clinical program like an MFT, you definitely do want clinical experience, but that's broadly defined, right? So they understand like you're not going to get experience as a therapist, but they want to see that you have like a longstanding commitment to mental health and to serving others. So that might be, like volunteering at schools, volunteering at a nursing home, volunteering at a cross crisis hotline, right? Doing ABA, working at like a residential center for foster youth, right? Um, and so if you can just show like you're good with other people and you are committed to like serving and helping others, like all of that translates into clinical skills. Right? Also, most students don't know this here, but within psych, you could do an internship and get course credit. So you can volunteer at an internship and get credit through 3950. Or if you have like a paid job that is related at all to psychology, including like, again, like working at a school as an aide or something, you can actually get credits for that. So you can get units and you can actually substitute one of your electives for that. So, if you're interested in that, just send an email to the psych department. We are hoping later this year to be able to like really ramp up our internship program. That's something I'm personally going to be working on next semester. But just so you know that that is an experience. Yes, thank you, Dr. Olagues. We also have 4850 where students work in mental health hospitals. So that's also something that you can apply to work in. All right, I'm going to go through these really fast so we have time for questions. And I'm also happy to stay later for more questions and make sure all of you have everything answered. So a lot of people, when they hear me say for a PhD, I really recommend you taking time off before applying. Like, there's a lot of hesitation around that, right? Because you don't want to be in school forever. Maybe it's hard to explain to your family why you're taking time off if you know that you're going to go to grad school. But again, these programs are really competitive and you want to have the strongest application. And so if you don't have all of the experiences that you really kind of needed to get in undergrad, which is understandable, you want to take that time after you graduate to really strengthen your experiences, right? So there's some like formal post-bac programs. You can get like a paid research position. And for that, I would just like email faculty that you're interested in, attach a resume, explain why you're interested, and just ask like, are you going to have any openings in your lab? There is also some research postings. It's not comprehensive, but at this website here. All right, clear interests that fit. Again, your personal statement is very, very important. For doctoral programs, you do need to have a very good fit. And you kind of want to balance. You don't want to be like overly specific, but you don't want to be too vague. Like you want to show you've been able to you've done your research, and you know what the program has to offer and what you can bring to it. All right. Lastly, letters of recommendation. Really, really important. I can't stress this enough. Ask people for letters that are going to be able to speak the strongest to the skills that grad programs are going to look for. Okay. So, you don't want letters that are like personal. Like don't ask a family friend for a letter. Don't ask your therapist for a letter of recommendation, please. I serve on admissions committees and I see letters of rec from people's therapists and it's just like not professional. It's not appropriate. So really think about what are the skills that they're going to be looking for and who can speak to that, right? So if you're applying to a research program, and you're working in a research lab, definitely like number one letter should be from your advisor. Maybe asking your research methods professor for that. If you're applying to a clinical program, and you volunteer at a school or you're like an ABA therapist, you definitely want letters from them to speak to that, right? So you want people that can like really speak to your skills. Think early about who you want to write a letter of recommendation for you. And ask them ahead of time. People get so many requests, and sometimes you might have been a really strong student, but they're like maxed out and they just can't overcommit. So ask earlier. If you only had a professor for like one course, make sure you stay in touch if you think you might ask them for a letter later on, go to office hours, and be really organized and prepared. So when you ask for a letter, make sure you have a CV or a resume. Make sure you have a list of like your programs and deadlines. It's helpful to have like your personal statement, anything that's going to help them to like write a more specific and strong letter. Lastly, it's a hard process, so don't be hard on yourself. Know that you're qualified and deserving, right? And so, even if it doesn't go as you hope the first time, that's not necessarily a reflection of you. It's just a reflection of how difficult things are. Having a bad economy does not help because everyone's trying to go to grad school. So just find your support system, utilize your resources, ask grad students, ask professors, if you can meet with them, if they can look over materials, people are willing to help you or here to help you. And just know that there is a light at the end of the tunnel. All right. So I know that was a lot of information. Again, I'll send these slides. Let me put it one more time for you to put your email address. I know I got some questions in the chat, so let me just see what I have not addressed. Okay, so there's a question, how many letters do we need, or does it vary by program? It does vary by program, but the standard is 3. So usually they ask for 3 letters. Some might ask for 4. I think very few ask for less than 3. So I would aim to have like three good letters. Do we email the mentors we're applying to for a PhD? What are we saying and asking to them? So you want to email potential mentors if you're applying to a doctoral program to kind of get your name, like get name recognition. Um, but you want to be really purposeful and intentional with emailing them. Okay. So you need to have like a purpose to email them. And if there is no purpose, then don't email them. Okay. Because they get so many emails, they're so busy. The last thing they want is like just a random email saying, hey, I'm applying to work with you. And like that might actually end up hurting you. So I would say like the two main things that you might want to email about that makes sense is one, asking if they are going to be accepting a student. Okay. But make sure that you do your research because usually that will be listed on the university's website. It'll say like these people are accepting students this year because not everyone accepts students every year. But if you do your research and it's not, you're not sure, like there's no information about that, then that's a great, easy way to email them saying, you know, hi, like this is why I'm interested in working with you. I'm planning on applying, but like, are you planning on accepting students this year? Another kind of easy thing to email about is to help get more information about like what kind of direction their lab might be going in or like what future projects students might be working on. So you might go to the faculty member's website and there might be very little information about their research or it might seem very outdated. And that might be a way to email and say, you know, I saw this on your website, like is this kind of what future students could anticipate working on, or do you have any new projects that you're anticipating starting in like the next year? So I'd say like those are kind of the two most common entry points. But again, if there's like not a need, like if they have so much information on their website and it answers all the questions, no need to email. And I say don't email so that you don't kind of bother them. Um, Let me see if there's more questions. Okay, could we still apply and contact faculty even if we don't have as much experience at all for application? So you are free to do what you want, right? But you want to kind of, you just want to think about like, are you really putting your best foot forward? Um, and I think thinking about like what the gap is, right? So it's like if you're applying to a PhD program and you have no research experience, like you're shooting yourself in the foot, right? Like you're just not going to get into a program, unfortunately. It's such a heavy process, right? You might be able to get into a PsyD program with no research experience. You can get into an MFT or an MSW program with no research. But for a research program like a PhD, like you need that experience, right? So if you have some experience, but you don't know if it's like strong enough, one, I think talk to your professors, right? Just to kind of get a sense from them, like, do they think that you're competitive? Maybe you're like, I want to just like try going through the process to see what it's like. So I'm going to apply to one or two schools, but I don't have like my hopes super high, and that's just a personal decision you make, and that's fine. But you want to just kind of think about like what are they looking for and like how big is the gap? Because again, these are competitive programs. And so you want to like really try to get as prepared as possible. Okay, I got another question. What does a typical week look like for students in a clinical PhD program, especially balancing research, practicum, clinical hours, and classes? So a typical day for a clinical psych PhD is they're wearing like five different hats. And it varies throughout the program. So when you first start a PhD program, it's going to be like very course heavy. You're taking a lot of classes. Then you start working on your master's thesis. So the research picks up there. Usually you aren't starting like clinical work right away. That might start like at the end of your first year, the beginning of your second year. It's going to vary by program. Um, a lot of times you'll start doing clinical work like in-house, like the program might have like a training clinic at the university before you go to like an outside clinic. But again, that's going to vary on the university. Um, but you're kind of balancing like taking classes, doing research, working as a therapist. A lot of times you might also be like a teaching assistant, right? And so you're maybe like running discussion sections or doing grading and stuff. And so you are juggling a lot of different hats and it just kind of varies, right? So As you get later into the program, you're not taking as many classes, but your research and your clinical work are picking up. So it's kind of hard to answer, but basically on any given day, like you can be doing all four of those things, right? You can like go to class, then go see clients at the clinic, and then have to work on your research, and then like do grading, right? And so I think that's the most challenging thing about like a PhD program is just you do have a lot of responsibilities, and they are all distinct. And so kind of finding that dance of like how to balance them, can be can be a little hard. Okay. Got a lot of questions. Do the professors necessarily have to be psych professors for letters of recommendation? No, they don't. Again, you want to think about like who can write you the strongest letters and what can they speak to, right? So, if you already have like one or two psych professors that are writing strong letters, and it's like there's a third that you've taken a class with, but they don't really know you very well, or you've taken another class with someone else outside of psychology who you feel like you've like really demonstrated your skills to and like they can write a really strong letter, go with the strongest letter, right? Um, you definitely like want them to be somewhat related if possible, but it's like if you have two strong like psych related letters and then a third that is strong but not necessarily psychology related, but they can like highlight certain things that a program might look for, that's also fine. Is it possible to make an appointment for NSS with you to see if courses you've taken are on track when applying to grad program? So I'm not an NSS, or sorry, I'm not a psych advisor. This semester, we don't have any psych advisors this semester. Next semester, we will have psych advising back, thankfully. Dr. Bauer is going to be doing most of our psych advising. I'll be doing a little bit. Um, but if you're wanting to meet with someone this semester, then it does need to be through NSS. And then next semester it could be through psychology. All right, what direction do I suggest for clinical psych internships? Again, I think anything that shows that you're able to work with people and that you like helping people, right? So again, that could be working with youth. You can find something that's like within your interest. So if you're like, I know that I want to like be a child therapist, then I'd recommend, volunteering somewhere where you can be working with kids. If you're like, I want to work with elderly people, then like maybe volunteering at like a nursing home, right? So finding something that's like somewhat related if possible. Crisis text line, suicide hotlines, really, really good experience that also shows like your passion and that's also just good training for you. I think all of those would be good options. Do I ever feel like research quality suffers because of practicum demands or vice versa? Yeah, it is always a hard balance, right? So the thing is when you are a therapist and you're a student doing a practicum or a clinical internship working with clients, that has to be your number one priority, right? Because these are people's lives. There are safety issues at play. You have an accountability and a responsibility to them. So if something is going on with your clients, like everything else needs to be on hold. Like that, you cannot fall behind with your clients, right? If you are teaching, you're accountable to your students. You can't really fall behind with your students. So a lot of times the research can be the thing that falls on the back burner a little bit, not because it's not important. Again, a lot of these programs, like that's the number one thing they emphasize, but because on the day to day, that's the thing that it's like less time sensitive and less like accountable to other people. So you just kind of have to figure out like finding a rhythm that works for you, finding like a set schedule, like setting aside like certain blocks of time that you're going to be working on research, is really important. All right, what would my advice be if we don't have research experience right now outside of talking to professors and all at this point? Should we go volunteering or learning more about the job, etc.? So if you are thinking that you're wanting to go into a PhD program and you don't have any research experience, um, I mean, the number one is going to be emailing professors here and seeing if they are accepting research assistants. So that's going to be your number one. there might not be a lot of opportunities. So outside of that, you might look at other universities that are nearby and email their professors and ask if they are accepting volunteer RAs. Okay. So that's going to be like your number one way. Sometimes there might be like a community mental health clinic that has like a research branch of it where they might take like research assistance, but that is going to be a little harder to find and not as many options. So definitely going through the university to find volunteer research experiences is going to be the most common. And then I saw Dr. O posted the Discord, so that is helpful. Thank you. Can my supervisor, who's a faculty member at Cal State LA, write a letter? Julie, I'm not sure in terms of supervisor where. Um, but yeah, anyone can write you a letter, right? The only kind of exception is like, let's say you are working to like be a master's student in my lab, right? Like I can't write you a letter to work with me. But I can write your letters for every other program that you're applying to work with. But yeah, there's no restrictions on like who can write the letters. How would I describe the culture and workload difference between clinical and non-clinical PhDs? Very, very different. So one thing I did not talk about here is like the subdisciplines of psychology that are not clinical. So like you can get a PhD in developmental psychology or cognitive psychology. So those programs are like purely research focused. You're not getting the clinical experience. So usually when they're shorter, they're usually like 5 years instead of 6. And the workload is much less. It's still intensive. You're still doing a lot of research, but you're not like the clinical psych or counseling or school psych programs have all of the same research expectations. And on top of that, the clinical expectations, um, which the clinical work is like, you know, can be 20 hours a week. So it is very significant in terms of that. Okay. See a question. What are some challenges that surprised me about the clinical side of training in a PhD program, emotionally or workload wise? Um, it is a lot of work. There's a very big learning curve. Doing clinical work for the first time is not something that you get experience in beforehand. And so there's a lot to like learn in terms of how you work with people. And obviously, in the beginning, there's like a lot of maybe nerves about that because you feel a very big responsibility. You don't feel competent at all. You're like, I've never done this. How am I supposed to support someone? Right. But if you're in a strong program, like they're going to make sure you have the training and the support. Um, so in terms of like the clinical skills, that's a very big learning curve. And then you also have to like learn all of the administrative stuff, like how do you write therapy notes and all of that, which can take a very long time in the beginning. And after you've been doing it for some time, it all gets easier and easier. So I think I'll say that in terms of workload, my work has all specialized in like trauma and working with foster youth. And so it is very emotionally taxing. And so having to figure out for you like how you're going to kind of maintain that balance and some degree of separation so that it doesn't like negatively impact you is something that every person has to kind of figure out for themselves. All right. Any other questions? Thanks everyone for coming. I'm still here, so if there are more questions, I'm happy to answer them. But if you need to leave, go ahead. And again, I will send out the slides over email later. But any more questions? All right. We'll wrap up there then. If you do have questions in the future, I'm happy to answer them. Again, I will be doing some psych advising next semester. So if you do have like specific questions around like applying to clinical programs, just reach out to the department and let them know. that you'd like to meet with me, and I can work that into my advising as well. All right. Thanks, everyone.